East Idaho Newsmakers is brought to you by the Bank of Commerce, your bank of a lifetime.
This is East Idaho Newsmakers with Nate Eaton.
Welcome to East Idaho Newsmakers. Today we are visiting with the CEO of EIRMC, who has been in the position since 1999, and you'll be there for what, 2 or 3? Well, one more month, really, just a few more weeks.
One more month, yeah. Be there through the end of the year. So December 31st, New Year's Eve, I'll go pack up the office and say goodbye to the crew for one last time.
Doug Crabtree has been with EIRMC at the CEO's position nearly 20 years, since 1999.
That's correct.
But you worked with the hospital before then as well, right?
I came to the hospital originally in 1991, and I was the assistant administrator, then promoted to the chief operations officer, and I was there through 97, so 6 years here, and then I left from 97 to 99, went over to Riverton, Wyoming, ran that little hospital for a couple of years, and then in the spring of 99 got the invitation to come back, and it was just a thrill. In 95, we had just expanded our women's center, and we had a construction company that, of course, built the perimeter fence around the construction. And on the outside of that fence, they had a sign, Eastern Idaho Regional Medical Center. And I thought, I got to take that sign with me. They're just going to throw it away. So I took that sign and put it in my garage in Ammon. And then when I left Ammon to go over to Riverton, Wyoming, I took that sign with me and put it in my garage as a daily reminder of my goal to get back to Eastern Idaho as the CEO. And that dream became a reality in May of 99, and it's been my pleasure and privilege and honor to be there ever since.
So where's the sign today?
In my garage,
Back in my garage.
Back in your garage.
Yeah. So when you came here in 1991, what type of hospital was EIRMC? I'm sure it's changed over the past 30 years.
Well, great question, Nate. It has certainly changed. And in 1991, we were a great little community hospital serving Idaho Falls. And now, 18 years, however many years that is later, we are a legitimate regional referral center, offering all kinds of services that we didn't used to provide, neonatology services, electrophysiology services. Our open heart program is continuing to grow and become better. We're doing great things as a hospital for this community and for this region.
When you set out on your career path, did you always want to work in medical care, or how did that path lead you here?
Oh, Nate, that's always an uncomfortable question for me. Actually, quite the opposite. My wife and I were at BYU Provo, and I was in their public administration program studying city and county governments, or human resource management at the corporate level. And I had promised my wife that she would never go hungry, that I would work hard and provide for her all the time, as long as I never had to live in a basement apartment, which we had to do, and as long as I never had to work in a hospital. And when I graduated from college, the only job I was lucky enough to get was in a hospital. We took it because the bills were coming. We thought we would just do that for a short period of time until we found something we wanted. And shortly I became aware of what a miracle that was in our life, to be able to work in a healthcare setting.
And you moved out of the basement.
And when we went to our first hospital job down in Payson, Utah, we lived in a small basement apartment, just trying to survive.
So you end up in Idaho Falls. Do you have any family here or anything?
Oh, I sure do.
Oh, you do? Okay.
Yeah, lots of family that goes back lots of years. My dad, Boyd Crabtree, had Crabtree Photography down on A Street. My grandfather, Glenn Crabtree, was the first oral surgeon in town. And Grandpa and Grandma had their cabin up in Island Park, right on the Buffalo River across from Ponds Lodge. So we would come from California, where I went to high school, and enjoy Island Park just about every summer.
So it wasn't your goal, though, necessarily to get back here, or was it?
No. It was not a goal. Again, right out of college, the goal was to find a job. And then we were lucky enough to get that job in Payson, Utah. And from Payson, I was able to, with the same company, I come to Idaho Falls. And I've been with that company now, Hospital Corporation of America, for 30 years. And 24 of the last 26 of those 30 years have been here at Eastern Idaho.
Healthcare is changing so much. There's a lot of talk about it daily, about insurance companies and medical care and whatnot. How has EIRMC been able to stay steady over the debates, over the changes, and still be a family-friendly local hospital while serving others, from outside the Idaho Falls area?
You remind me with that question, Nate, of Mayor Linda Milam years ago when she was serving as our mayor, said that she really wanted Idaho Falls to be a great little community hospital with the high touch, but also was really anxious that we became high tech, pulling people in as part of the economic driver for the city of Idaho Falls and the economy of Idaho Falls by offering those high-tech services to people in our region. And it's been our goal to continue to do both, to be a high-touch local community hospital. I like to often say that we are a bunch of family and friends providing care to a bunch of family and friends. And if we're doing our job right at the hospital when you come in and we don't know you, if we've done our job right by the time you leave, you ought to be our friend. We ought to be your friend.
A lot of people say, I love Idaho Falls, I just wish, there was a little bit more medical care. If I have cancer, I have to go to Salt Lake. Or if I have a heart transplant, I have to go to Salt Lake. Do you foresee the day where traveling to Salt Lake or Boise won't be necessary?
Well, it's interesting, you look at the future about what medicine's going to bring, and everything's different. Everything will be different in 10 years or 20 years. I recently went to a fascinating meeting with a company called Intuitive. Intuitive builds surgical robots. That's what they do for a living, is surgical robots. And the CEO of that company came in and talked to us, and he said, how many of you think we'll be doing surgery in 20 years? Now, this is the guy who owns and runs, he works for Intuitive. And his question is, will we be doing surgery in 20 years? Will medicine become so precise? Will we be able to match medicine to each patient's specific genes and everything so precisely that we won't need to do surgery? Now that's an intriguing question, but the other part of your question is, what services do we currently not provide that lead people to go out of town? And we now have neonatology services. One of the exciting things that we're doing is building our pediatric service line. So over the last several years, we've brought in pediatric cardiology, pediatric GI, pediatric endocrinology, and we're very pleased that Dr. Webb, who graduated from Hillcrest High School, has returned to the Idaho Falls area after completing his fellowship in pediatric anesthesia. And so our next building block to complete the service line of pediatric services, in addition, we've got the pediatric intensive care specialist, intensivist, Dr. Gardner and Dr. Hertzig. The next step we need to go forward with is pediatric surgery, and we currently are recruiting for that specialty. That specialty will minimize the number of people that have to leave Idaho Falls to Boise or Salt Lake or Denver for surgical care for those pediatric patients.
So as the CEO, do you kind of go section by section, like let's focus on pediatrics, how do we improve and do more here, and then move on? How do you decide which area to focus on?
Nate, we don't. We look at pediatrics as a huge opportunity for us to provide care to the region. We listen to other people in the region that come to us and say, hey, it would be really slick if we could provide this service X or this service Y. But whenever we focus on a service like pediatrics, that doesn't mean that we can let everything else go, because everything else is continuing to evolve at the same time. And so it's just a real great opportunity to lead a team of 200 doctors and 1,400 employees who all help carry that challenge and that burden of evolving as medicine evolves, to make sure we're providing the most recent state-of-the-art medicine we can to our patients.
The neonatal intensive care unit is pretty impressive for East Idaho, and a lot of people, I don't know if they know how cool it is that these preemie babies you can keep here and you don't have to send to primary children's.
That is correct, and there are some of those preemie babies that are at 22, 23 weeks gestation that would have never survived the trip to Salt Lake. And so now not only do we keep them here, but we keep them alive. And we've got our census this morning, I spoke with our director, Heidi Thompson, before I came over, and our census this morning in the NICU is 25. We've got a 26-bed unit, and 25 of those 26 beds are full. And we're very fortunate to have the expertise we have with our neonatologists and our team of neonatologists and our nursing and respiratory therapy staff that all work together to keep those kiddos alive and doing well and thriving. And you know, I remember one of the first 22 weekers we had, or just shy of 23 weekers. It's just a thrill to see he and his family come out to our EIRMC Family Fun Day and see him grow, and just a great kid.
How do you keep the cost of health care reasonable for every family? I'm sure you're asked that a lot. Is this a hot topic? How do you keep it so that, you know, the average person can go to the doctor when they need to go to the doctor?
You know, such a great question, and so complex, and so many different things we could talk about in terms of the costs of health care. You know, we've talked a lot about health care reform, and it continues to be debated about, are we going to repeal and replace, are we going to modify, are we going to do this, are we going to do that? But at the end of the day, I think we've missed the mark a little bit in terms of health care reform. Right now, we pay our physicians and our providers when they do something to you. So if I go to my family practice physician and he says, Doug, if you don't lose weight in the next couple of years, you're going to need your knees replaced, and we incentivize him to take care of me to avoid my knee replacement, that might be a better approach than what we currently do. Is we currently have a system where we pay physicians when they do something to us. So if I go to the orthopedic surgeon and he replaces my knee, he gets paid for that. The family practice doc who's trying to keep me healthy, they don't get paid to try to keep me healthy. We currently pay for illness, when other countries have had some success for paying for preventive services and for maintenance instead of just episodic care when you need something done.
And how do you start to get that message out? That's the challenge.
That is indeed the challenge, because it's such a complex industry with so many different constituents that all have their piece, and their piece they do very well. And we advance medicine globally because of the things we do here in the USA, but it's such a challenge to be affordable and to be, you know, across the nation. Affordable health care is a real challenge for us. Another thing that I think we miss the mark on is not only in terms of how we reimburse providers and physicians and hospitals, but also I think we miss the mark a little bit about some of our own personal accountability when it comes to health care. We know the things we should all do to be healthier, and yet how many of us do those things? Eat right, get enough sleep, exercise, you know, address those things that we know that we could do to prevent illness down the road for ourselves and those chronic conditions if we just took care of, you know, better care of ourselves right now.
Yeah. We're going to take a quick break. When we come back, I want to talk about some of the lessons you've learned as CEO, some mistakes you've made that you've learned from, and what's next for you and the hospital. So we'll be right back.
At the Bank of Commerce, we understand the hard work, determination, and sacrifice it takes to run a successful business. That's why we're here every step of the way to help make your dreams come true. The Bank of Commerce, your bank of a lifetime.
Welcome back to East Idaho Newsmakers. Today we are talking with the CEO of Eastern Idaho Regional Medical Center, Doug Crabtree. He has announced his retirement and will be hanging it up at the end of the year. What's next? What do you plan to do?
You know, I don't know. I don't have any immediate plans. My wife, Shauna, is an educator at Hillcrest, where she will continue to teach senior English and senior projects. And I'm not exactly sure what I'm doing. We're looking at options right now.
You guys plan to stay here, at least for the near future?
Oh, we sure do, you bet. This is home.
So, as CEO of a hospital, I'm sure you learn a lot.
You do indeed.
What are some of the key lessons you've learned that maybe you wouldn't mind sharing with our audience that might help them or teach them?
Well, I think, you know, earlier we talked a little bit about the NICU, and perhaps I can just tell you how the NICU came to be. We sent one of our nurses away to a conference, and we were trying to further her education and skill development. And then she came back from that conference and she said, Doug, have we ever thought about, you know, this kind of NICU and a neonatologist and this and that and the other? And she and I talked for a long time over a lunch break, I believe. And I said, well, I need to be educated. Help me understand. And she said, and by the way, I've got a physician who might want to be interested in relocating up here. And because we sent that nurse to education, had a relationship with her that she felt comfortable coming back and talking to us, we pursued that NICU. at her recommendation and based on her level of understanding and education. And she saw the vision of what we could be, and then she brought that vision to us. And because we had established enough of a relationship that she felt comfortable sharing that with me, we pursued that physician, Dr. Shannon Jenkins, who was our first neonatologist that we had come to Idaho Falls. So I think what's been really important is to continue to surround ourselves as a leadership team and to continue to recruit the best and the brightest of the physicians that are available and the nursing staff, the therapy staff, and have them bring their expertise to us, and then we need to listen and listen to them about how we can continue to improve the services and quality at the hospital.
Is there a mistake that you made or some judgment that you've made over your tenure that you think, you know, if I could change that, I would have done this?
Oh, I think anyone that looks back at a 30-year career or an 18-year experiences, you know, at one place, certainly I have things that I regret. Certainly I wish I would have done this better or that better, or I wish I would have been able to impact this more or that more. You know, I wish we would have been able to impact Medicaid reform in the state of Idaho more than we've done. We certainly have given it a lot of attention, a lot of effort, but we have fell short of getting any kind of Medicaid expansion done for us. And that's one thing that quickly comes to mind about how I was not necessarily as effective as I would have wanted to be to get Medicaid expansion done.
What would you say is the biggest challenge facing EIRMC for the next 5 or 10 years that you won't have to deal with, but the new CEO will?
Well, we're really excited. Today we've got 9 students, 9 medical students who have finished their medical school, and now they're looking for a place to do their residency. And I think you may have heard already, Nate, that we're expanding the hospital into a graduate medical education program offering a residency for internal medicine physicians. We're excited to have 9 people here from across the world coming to interview for one of our 10 spots in internal medicine. And for those 10 spots, we've had over 600 applicants, which speaks highly of the medical center, highly of the physicians and the nurses that we have, but it also speaks highly of the region that we live in to attract that many people, again, from across the world to come to Idaho Falls, I think is incredible. I think that medical residency program will prove to be a huge benefit to us at the hospital and to the region, and it's going to do great things for us.
When you look at EIRMC in 5 or 10 years, do you see more expansion, maybe a new building or 2 down there?
Yes. There'll be more expansion, again, as we develop a number of our current service areas. And you know, we've got about a $20 million building project underway currently, Nate, where we're going to redo the front lobby. We're going to redo all of the 5th floor has been redone. Now we've got to catch up and do 2nd and 3rd and 4th. We're going to renovate our emergency room and expand it from its current 29 or 30 bays to about 41 bays. 6 of those will be dedicated to peds services as we try to make our ER more of a kid-friendly place, at least that section of it. So a lot of stuff's going to happen in the next 2 or 3 years at the hospital that'll just be fun to watch develop, and all the plans are in place, the funds have been secured, so we're excited about that. We've also got some service lines that'll be real game changers when we're able to introduce them in a public way into the community.
You're known for saying we are a bunch of friends and family taking care of friends and family. Why has that been your approach to leadership?
Well, I think, Nate, it goes back to kind of the team that we've assembled. We work hard. We understand that the nature of our work is very important. Some might say the work we do is a sacred work. It's more than just a job. And we want to have a great time doing that service, but we also want our patients and others that are involved in providing care to that patient to enjoy their work and to enjoy their experience. We want our patients to have good outcomes. But part of that good outcome is we want them to have a great experience with us. And we do want to have a feel at a hospital that's a fairly large, sophisticated medical center of still being what Mayor Milam talked about in terms of a high-touch community hospital. And that's why we often talk about how we are a bunch of family and friends, providing care to a bunch of family and friends.
What will you miss?
I will miss the interaction with the patients. I'll miss the interaction with the crew, the people who I work closest with. I'll miss the fun. I'll miss, I love to go out and round on patients. I love to go out and visit our employees, and I will miss that.
What won't you miss?
Negotiations with insurance companies.
You answered that quickly.
Yeah. I've had an opportunity to think about what it is that I will miss the most, and it is the people. It's the interaction. I'll miss the opportunity to be instrumental in developing those services and increasing the number of services and the quality of those services. I'll miss that. But at the end of the day, what I'll miss are my friends who we work together to provide great experiences for the patients. I'll miss that. I'll miss being in the hall. This morning I was walking in about 7 o'clock this morning, and usually at 7 o'clock in the morning the halls are pretty quiet. But walked into the hallway, and I met a gentleman whose loved one is in the hospital. He found her nearly unresponsive, and talked about how his struggles at the farm and his worries about the cattle, and introduced himself to me. And now this gentleman and I are good friends, and I'll go check on him this afternoon. And if I were to see him again in the grocery store, that would be a very positive interaction, and I will miss that.
There's a lot of CEOs at hospitals that maybe stay in their office all day and rarely see a patient. They're focused on the numbers and the budgets and the money. And that if they were to show up for an interview like this, there'd be a team of people around them. You drove yourself over and there's no one else here. You're talking about going out and meeting the patients. Is that kind of a unique thing, do you think, to East Idaho, or is that something that you've really tried to just be you?
I think I just try to do the things I do, and I just try to be me. And that's what's important to me, are those relationships. There's a physician who was around in the 15 or 1600s. Dr. Tony Golden, one of my favorite family practice docs, told me this, enlightened me. And he gave me the Oath of Maimonides, which talks about the important work that we do in a hospital. He was a physician, so his oath primarily applies to physicians, but I think it has to do with us as well as hospital administrators and everyone that works in a hospital. And that is, remember, every patient that we see is just another fellow creature on this planet, and they're in pain. So it's our job and our responsibility, and he refers to it as a calling to go and provide care to these patients. And it's just a thrill for me to have had a chance to work there, and just love every day.
There's a lot of thousands of patients I'm sure you've touched or met, and thousands of employees over the years. What would your message be to them as you walk out those doors New Year's Eve for the last time?
Well, to those physicians and employees that are there, my first message would be thank you. Thanks for the great work that you do. Thanks for your dedication and commitment and passion. Thanks for the compassionate way you provide, the way you provide care. Many years ago, when I first came to the hospital, there was a tension between this department and that department, and we asked our employees to come up with what values were important for them. We at the hospital now know those values, or that set of guiding principles, as EIRMC. So my goal would be for them to never forget our EIRMC principles and values of respect, enjoyment, accountability, loyalty, integrity, and quality. And if we can remember to do those things with an emphasis always on focusing on the patient and doing the right thing, doing the best we can, everybody at the hospital will be fine.
Well, it's one of the places I hope I never have to go.
I understand.
And that most of our audience never has to go. And we wish you the best.
Well, Nate, I appreciate that, and very much would like to just take a minute and thank everyone that I've ever worked with, thank everyone I've ever had the pleasure of associating with, and particularly thanks to the community of Idaho Falls and southeastern Idaho, and all of those who have supported and been kind to me and my family over the last many years. Thank you.
And they have not named a new CEO yet. Any idea when that will come?
I think they're in the process right now of interviews, and I think that we'll have an announcement before the end of the year.
Doug Crabtree, thank you so much for coming in here to East Idaho Newsmakers. Again, he's been the CEO of EIRMC since 1999 and has a long, distinguished career in healthcare, and hopefully you can rest a little.
I plan to. Thank you.
Thank you. And thank you for watching East Idaho Newsmakers. We'll see you next week.
Idaho Newsmakers is brought to you by the Bank of Commerce, your bank of a lifetime.